One thing that I definitely hear a little too much of is that I want my teeth to look white like a celebrity. Well, I hate to break it to you, that's all a lie. They're veneers. They're not real teeth. You're never gonna have as white of a tooth as a fake tooth. The most important thing is that your teeth are healthy. If your teeth are healthy and they are comfortable, then they are beautiful. When it comes to something like whitening, what happens is that you use some sort of peroxide, either carbamide peroxide, hydrogen peroxide, or there's a whole bunch of other products out there, and it soaks into the inner layer of your tooth. That means you put the peroxide gel on the outer side of the tooth, and it will go through your dental tubules, oxidize the stain in the enamel and the dentin of your tooth. This can rush right through and therefore aggravate that nerve and create what I call zingers, or some intense sensitivities during whitening process. A fantastic way to reduce the sensitivity with the whitening is to make sure that you use a sensitivity toothpaste, specifically the Pronamel, with some potassium nitrate in it. At night, before bed, smear it on all your teeth, spit it out as much as you can, and don't rinse it out. When it comes to whitening, using a toothpaste to prepare your tooth with potassium nitrate, like the Sensodyne Pronamel, will work the best. The potassium nitrate inside of the Pronamel will help to calm down the nerve because it stops the action potential. It'll block the pain signals from reaching your brain. Using toothpaste like the Pronamel about 1 week before whitening will significantly reduce those zingers and discomforts that you may have. One way that I like to make sure that my whitening is much more comfortable is I'll whiten every other day. A lot of the directions say to whiten 7 days in a row, and if that's comfortable for you, give it your all. I tend to have sensitivity when that happens, so I will usually whiten every other day or every 3 days. This helps my tooth take some time to rehydrate, because the peroxide does dehydrate the tooth. And that helps to make sure that A, I can track how white my teeth are, if different types of enamel whiten differently, and if I have any spotting on my teeth, and to make sure I reduce any sensitivity while I go through the process. There's a whole bunch of whitening toothpaste out there on the market. The main thing with the whitening toothpaste is it is more abrasive. One thing to be cautious with is if you use something abrasive every single day, twice a day, for years and years and years, and decades and decades and decades, it can really thin out your enamel. If you use too much of an abrasive toothpaste, you can over time scrub away that outer layer of your tooth and make your enamel quite thin. When your enamel is thinner, the inner layer of your tooth, called the dentin, that is a yellowish color, will start to show through that translucent enamel, which is the whiter color, much faster. If you use a whitening toothpaste that's abrasive for too long, that will make it so that your teeth are actually more yellow. To make sure you're using a whitening toothpaste as a polisher, maybe once a day. I usually use my whitening in the morning, sensitivity toothpaste at night, or every few days. Using a whitening toothpaste is really good with an electric Oral-B type toothbrush because the circle head is a great polisher. It'll make sure that it gets around the corners of all of your teeth. You want a healthy smile to have a beautiful and a happy smile.